Hey everyone, it's Dr. Chook from the Toronto Concussion Clinic, and today I'm going to show you a gaze stabilization exercise. Now, many of our patients don't actually need gaze stabilization exercises. Their gaze is actually pretty stable for a lot of our patients. However, a lot of them have problems with just withstanding visual motion and things like that. So this exercise can be used for both. It can be used to help stabilize gaze, but it can also be used to help habituate yourself to movement and visual motion and so on. So I'm going to show you one today called X1, and in another video, I'll show you this one too. In this video I'll show you X2 also. So in X1 you get like this, like a little bit of a letter, like a letter X or something like that. Something that's small enough that you still got to try a bit to bring it in focus. And then what you got to do is you just got to stare at it, and then while you're staring at it, you have to move your head. So for those people who need to do this for the gaze stabilization aspect of it, you're training the vestibular ocular reflex by doing that. And obviously, there's certain things that can make you better at learning that, like spirits of mindfulness and relaxation and so on. Now, the object you use, you can change it up. So you could get like something that's opaque. This one's on a transparency, but you can get something opaque. You can get like a heart chart. So I have a heart chart on here. I don't know if you can see that. And so you can get people to read it out. And then you can time it so that you do it to a metronome. So I'm just going to pull up a metronome here you get these apps for free. Here it is. And so I can start off with something like this, and I'm just going like that. It's harder when it's a transparency, especially if you're doing it up against like a busy background like this. Because that can throw off some people post-concussion. So like that, and then you go to the beat, O, F, N, P, V, D, T, C, H, E. And then slowly, you can speed it up, Like most of us should be able to do it this fast. Like that. And O, F, N, P, V, D, T, C, H, like that. So you don't have to get like a heart chart, you don't have to read, because that requires me to kind of pick up where I left off, You could start off simple. And then you can also do all the things we talked about before. So you could stand like this, or you could stand like that, or you could stand on foam, or you could have like people tossing you objects in your periphery, and you have to catch them while you're doing this exercise, right? Or people shining lasers in your periphery, and you got to point at them while you're doing this exercise. So there's so many ways you can change it. You can do it while you're walking. You can do it, like this on an angle, right? Then there's another variation of this exercise called an X2. So X1, you remember, is just my head moving, and this is stationary. You don't have to hold it. You can always just pin it up against the wall. Obviously a big 9 like this is too big, so you want something small enough that it's challenging, right? And but you don't want it to be, you have to make it clear if you want this exercise to work. So the X2 version is you kind of move both, your head and your arm. So you won't be able to move it as fast and by as great an amplitude because you're moving both. So you just go like that, and you do the same thing. O, F, N, P, V, D, T, C, H, E, and so on. So I hope that video was helpful to you guys, and stay tuned for another video where we help show you some exercises that can help you on your road to recovery. Take care, everyone.